All right, everyone. Hello and welcome officially. We are delighted to have you join us today. This webinar will be recorded and the recording and the slides will be sent to you via email. And of course, during these live presentations, please excuse cameos from our canine colleagues and any other unexpected moments. And we hope that this doesn't happen, but if the webinar were to close unexpectedly, please reopen it from the link that you used to attend this presentation. And of course, we welcome your questions. Please type in questions at any time using the Q&A box, which is on the bottom of your Zoom window. Other people can't see your name when you type in a question. So if you choose to be anonymous, just click that anonymous button so that no one else can see your name. A live transcript is available. To hide or show that transcript, click the up arrow button, which is next to your live transcript button, again, down at the bottom of your Zoom window. And please note, for those who are joining us on a phone or a tablet, the Zoom app currently only highlights the active speaker. So the live transcript will be available, but you may need to scroll right or left to be able to see the presenter or the presentation. And for privacy, all participants are in listen-only mode with microphones muted, and chat between participants is unavailable, but you can chat to the panelists at any time. And one last note, if you are posting to social media about what you've learned here, please use the hashtag ICPSR. And once again, this webinar will be recorded and the slides will be sent via email. And now I would like to give a warm welcome to David Thomas, who is a Senior Data Project Manager here at ICPSR, and Skylar Hawthorne, who is a Research Technician and Data Curator at ICPSR. And with that, David, the floor is yours.
All right, great. Thank you, Anna. Welcome, everyone. As you know, this is a webinar about the TransPop data here at ICPSR. It's important to make that distinction here at ICPSR because we want to make sure everyone here understands what's going to happen and what our lane is. So our lane is, we're ICPSR, hopefully you know this, right? And we're a data archive. And so we disseminate data, we bring data in, we disseminate data. And for this particular webinar, some of the data we're talking about are the TransPop data. And those data, just as you see the slide right now, we want to talk about the parties responsible for the data, right? And then prominent person is Elon Meyer, researcher at the Williams Institute at UCLA. These data were funded by NICHD, National Institute of Child Health and Human Development, which is part of NIH. At ICPSR, as you know, we have multiple projects and pages. And so because of the funding by NICHD, these data are primarily housed at DSDR, the Data Sharing for Demographic Research. And so DSDR, again, also is funded by NICHD, and that's how this gets involved. I actually work with the Resource Center for Minority Data here at ICPSR. And so the reason why I'm also here is because the population represented could also fall into an underrepresented population, particularly in data, which is why these data are so exciting. Skylar, if you would go to the next slide. All right, so here are some things I want to highlight before we have Skylar really get into these particular data. These are part of a broader set of data from the Williams Institute and Dr. Meyer. And those data include Project Stride, the generations data set, which has an additional update coming, an older data set about women's health in Boston and Cambridge, and then a combined baseline generations and TransPop data set that is also forthcoming. Wanted to bring your attention to already what has happened and what is already available, also to what's coming, so you know to come back and look for updates and look for new information. As you as researchers and just interested, because sometimes it's research, sometimes it's me search. And as you're interested to know, these are some of the things that we are bringing forth to you, as well as always working on improving our search so that people have better outcomes and results from searching, particularly when it comes to doing research and doing searching for data on particularly trans populations, but also inclusive of LGBTQ populations. Next slide, please. All right, going back to the distinction. So again, this is about accessing these data through ICPSR. If you're interested in getting findings from the data, history of the data, researchers using these data, we're going to direct you to this Minority Stress and Health of Transgender People. This link is actually a webinar done by the PIs that was done on June 28th. And you can go and look for that. And that will give you some of that additional information that you were looking for. Another piece to note is the data-related literature part of ICPSR. And so it's important to kind of just highlight some of these. So this is a great part of live. We will provide that link because I understand you are not able to click on the screen. I will get that to everyone. And so you're welcome. And so just highlighting some of the other pieces of, if you go on the site and you look at this and you will see the site, don't worry, because I'm going to let Skylar talk in just like another 2 minutes, because that's why you're here. To hear some of the articles of demographics and health outcomes in a US probability sample of transgender parents. So that's looking at parenting. As you look at the intersection of race, we have AAPI, LGBT adults in the US, LGBT well-being at the intersection of race. And another one is health and healthcare access in the US transgender population health survey, TransPop. And so those are just a few of the examples of some recent 2021 articles and research that are coming out of these. And those will be also talked about more in Skylar's piece as well. Next slide. All right, now I'm going to turn it over to Skylar. As Anna said, Skylar is a data curator here at ICPSR. One of the wonderful things is that Skylar was responsible for working through these data and getting them up at ICPSR. So Skylar, take it away.
Yes, hello everyone. I am Skylar Hawthorne and I had the honor of being the data curator for this study. That means I was the person that cleaned, organized, reviewed, and redacted these data. I also wrote the metadata, created the code books, and configured the online data analysis capabilities. So I've done quite a lot of work with TransPop. I'm very familiar with it and I'm super excited to show it off. To show you all just about everything about these data, certainly everything you'll need to know to effectively use these data, and by doing so, to help advocate for the transgender community. I'm transgender myself, and there's nothing more I want to do with my life than to make the world a better place for trans people than it was for me. So when I first noticed the study in the ICPSR queue, I reached out to my supervisor, asked him to assign it to me, and thankfully he did. That was way back in December. I just ran the script to release these data in June. That makes this the biggest project of my life, but it was also the most rewarding project of my life. Already, these data have been downloaded over 600 times, and there's been over 10 data-related publications. Today, I will show you how to do just that, how to download these data, how to use them, and hopefully that might help some of you publish a paper from them. In the wise words of the PI, Sari Reisner, we have much work to do in looking at these data. Ideally, this webinar will facilitate that work. So let's dive in. I'm going to show you all the methodology, the documentation. There's quite a lot of code books, questionnaires, and even a user guide. There's the social science variable database with summary statistics and online secure data analysis, all really exciting stuff. So I'm going to demonstrate all that, but before I do, I thought I'd share some slides from the PI's webinar that attest to the importance of these data and the importance of research on the transgender community. So on June 28th, I think, the PIs did their own webinar where they showed the initial findings from the data. It's an amazing webinar. I highly recommend it. There's a link to it on the study's homepage. And so here you can see some of the rates of discrimination that trans people face. The statistical significance is symbolized by the 2 dots. So here you can see the p-value is less than 0.01. And on this next slide, you can see the reason for this discrimination, which amongst trans people is primarily for being transgender. This third slide of the PI is the last slide I'm going to show because some of you have probably seen the PI's webinar already. This is the one that hit me the hardest, that trans people experience bullying at over 3 times the rate of cisgender people. And I think that's something that everyone can relate to. Most everyone's been bullied at least once in their life, and to see the rate that trans people experience is really hit me hard. So this speaks to the importance of these data and the importance of research on the transgender community, because it's one thing to say that trans people face discrimination. It's another thing to say that trans people face discrimination at rates 2 times higher than, like 2 times higher in this domain or 5 times more severely in this other domain. Like, it's one thing to say that trans people of color are the most marginalized community in the country. It's another thing to say that trans people of color at the intersection of racism, misogyny, and transphobia are 3 times more likely to experience police violence, 4 times more likely to be unemployed, and 5 times more likely to be homeless compared to the general population. Those statistics are tragic, objective, and they get the point across. So we need more data like these, more publications from data like this, because this is the data that policymakers and legal advocates need to design evidence-based public health and policy interventions. This is the data that's needed to effectively press the case for equity and justice. Really, the importance of these data cannot be understated. And I'm glad to see that there's so many people here today that are interested in working with these data and that are interested in advocating for the transgender community. It gives me hope. So without further ado, let me show you how to use these data. A major aspect of these data that's important to note is that it's a combination release. So there's restricted data and public data. The restricted data are just slightly redacted. There were some direct identifiers and open-ended string responses. So like the variable Q21 that had a name in it that I replaced with masked by ICPSR. The public use data has also been spot masked, but to a greater extent. So like in the public use data, specific Native American tribes have been masked. And also the more specific geographic variables have been masked, like zip code. But there are still some geographic variables in the public data, like census division. And in both data sets, I top coded the age variables because on both ends of the tail, so the distribution, there were some very low frequencies. So the ages were top coded at 72 and for the year of birth at 1946. David, could you say a few words about how to access the restricted use data?
Yes, and I will turn on my camera. There we go. All right. So if you could, Skylar, go to the next slide. So this will be quick because this isn't what you want to, that's not why you're here. the public use data, again, like Skylar said, you can download those data directly to your computer, provided you have you do all the authentications and stuff like that. These are not firewalls, just things like making sure you're, acknowledge the terms of use, stuff like that. The restricted use data, you have two options. You have a secure download, and you have the virtual data enclave option. These are both standard with data coming out of DSDR, also again, funded by NICHD. Next slide, please. And then so with the restricted data, you're going to have to go through some requirements in a restricted use agreement. And this is an agreement between institutions. University of Michigan is where ICPSR is. So that would be one side of that agreement. The other side of the agreement would be the intended researchers institution. This is required because there are certain things about how you protect the data, how you house the data, what you say you will do with the data that require certain things to be certified and agreed to, and all of those things. So super important that you do that. And that's why that's up there. Because again, as Skylar said, there's more openness of these data. So that's why we need those protections in there to ensure protections of the populations and the individuals. So next slide, please. This is an example of what you would get if you click on the Access Restricted Data button in the study, and what this will set you up for is, one, to see whether or not make your decision about whether you want to go with secure download or virtual data enclave, and also will tell you some more information about what you might need to do this and to apply. Just another piece is that this is not like a super quick process. We try to go as fast as possible, but many times what happens is the delay will be in getting all the proper signatures. So if you're hoping to get finish a quick project, and then get this out, is probably not the way to go, going restricted data or going with a question that requires use of the restricted data. We bring that up a lot because to set the expectations. We feel really bad if someone's like, I need to get this out in 2 weeks. And we're like, yeah, that's not going to happen. So yeah, that's the end of my piece on this. So now you can go back to the substance.
Okay, so I'm going to take us to the study homepage. This is the DOI, but I am going to start at the very beginning by going into our website, icpsr.umich.edu. So there are a few ways you can find these data. The most intuitive is to just search TransPop. And then the study will come right up. So this is the study homepage. And from here, you can see the principal investigator, the amount of downloads, the data-related publications. This is the metadata, so we have a summary. Importantly, this is the citation. Here you can access the PI's webinar on the right. Right here is the webinar that is currently happening. So more metadata, we have the scope of the project. Here we have a link to the TransPop website, which is very helpful and contains a lot of great information. I'm gonna go back now. There's a lot of methodology here. You can find out about the response rates, the presence of all the common scales used. And that's the majority of the metadata. Here, this tab, variables, is known as the Social Science Variable Database. And this gives us summary statistics. So for any of these variables, you can click on it and it will display summary statistics for you to view. So how often did a parent or adult in your home ever swear at you, insult you, or put you down? You can see here that, well, the rates are higher than ideal. And you can view summary statistics on every single variable in the whole study. Can sort them by the variable label, by the study number or data set. So this is in the, now they're being displayed in the order that they are in the data. This next tab is data related publications. There are currently 11, but this number is certain to grow. The PI, Elon Meyer, has a great quote. "We have a lot of data. We have dissertation projects looking at these data. We'll likely see a lot more publications." And so if anybody here does publish a paper on these data in the future, you can have your publication added to this list by clicking here, suggest a new citation. And this will take you to a page that is pretty quick and easy to fill out. And then your publication will be linked. Okay, now let's take a quick look at the actual data and the documentation. So there are 6 data sets total, and in the order of TransPop, public, and restricted. Then data sets 3 and 4 are the cisgender sample for comparison, public and restricted, and then the combination data set, which is the concatenation of both of these data sets. And there's a lot of documentation on all of these data sets. There is the PI codebook, the ICPSR codebook, and the questionnaires. I will show you the ICPSR codebook. It's the one that I created. I'm really proud of it. And as soon as it loads, here it is. So importantly, there are processing notes, and this is something that is really important for me to talk about.
Tyler, I'm just going to pop in real quick that we haven't yet switched over to that window.
Oh, okay. Anna, thank you for pointing that out. I will be sure to share the correct window. Here it is. Okay, so this is the ICPSR codebook. First page is a cover page. Next page is just general terms of use. And then there are the processing notes. So up top here, you can see the list of variables that were redacted, that were spot masked, blanket masked, or top coded. And then there's a list of variable discrepancies. So the PIs have their own code book, and there are some very, very minor discrepancies in them. So for example, the variables Q21 verb and Q86 verb are named Q21 and Q86 without the underscore verb in the PI code books. And similarly, the variable Q50 verb is named Q50. Also, the variable GD7 is totally omitted from the PI codebook. And that's the total extent of the discrepancies. There were some very minor variable recodes just to match the PI's top coding. And there's also a note of a qualitative data file. So certain statistical packages have character limitations, and several of the open-ended string variables exceeded those limitations. So instead of them getting truncated, we exported them to a qualitative data file. So I will show that qualitative data file, but I will first finish showing the ICPSR codebook. So there are some variable groups. Here we have the scaled demographic variables, positive health, stressors, and there's a total of 420 pages. So we will not be perusing every single page today, but there is a lot of great information here. So now I'm going to stop sharing this screen and show off the qualitative data file. So now we're back here. Wait, I'm sorry, one sec. Here is the qualitative data file. So these variables were exported so that they wouldn't have to get truncated. Here, this is an example of a spot mask where a Native American tribe was replaced by this quote for the sake of confidentiality. And so this is the qualitative data. And now I'm going to go back and demonstrate the crosswalk. So since there are multiple data sets and a combination, and a combination data set, there's a crosswalk called documentation PDF multi, and that is now downloading. And I am going to reshare that screen so that you guys can all see this crosswalk as soon as it downloads. I wanted to walk through this data on the spot with you all, because if any of you use this data, this is what you will be doing, and this is the process that you will be going through to use these data. So I am now going to share my screen again and demonstrate the crosswalk. So again, first page is a cover page. Next page is the terms of use, and then there's the crosswalk. So here you can see in the first column, the TransPop, the data set number 1 and 2 variable name, and then the cisgender variable, the cisgender data sets variable names. And you can see that for the most part, there's overlap, like Q19C is equivalent to Q19C, but as you get further on, they can start to see some discrepancies, like Q36B is actually equivalent to the cisgender variables Q34B. So this document can be really helpful when using both data sets. Lastly, I have one last document to demonstrate. It's the PI's user guide, which contains a lot of valuable information that is really helpful, like how to use weights. So weights are certainly something that we all know about, but might not be experts at. They're notoriously confusing. Thankfully, the PIs made it very easy to use the weight variables with these data. This user guide that I'm about to demonstrate shows that it also has some methodology information and much more. So I'm going to share my screen again. And here we go. So this is the user guide. Starts on page 3. I have a table of contents. There are bookmarks on the left-hand column, so you can jump to any spot in the whole 86-page user guide that you would like to. We have about the study, data sources, recruitment, procedure, and at the very end, weights. So this is starting on page 39. This is some good information to know if you plan on using weights. And now let's actually use some of these weights. I am going to demonstrate the online secure data analysis capabilities of this study. So I'm going to go back to the study homepage right here. And so the SDA, Secure Data Analysis, is available on this button, Secure or Analyze Online. There's multiple ways you can do so. Today, I will show off the full analysis capabilities. It's going to have me log in. And this is the SDA. So real quick, general overview of how to use this. You can access the codebook here, and that was this tab up here. There's also, I showed the proc notes earlier. You can also access the proc notes on this tab as soon as it loads. These proc notes are actually a little bit more elaborate. They contain some of the weight variable information. So to actually use the SDA and to analyze the data, you have a list of all the variables in the left. So I will pick one at random. How about education? We'll copy that into the row, and let's do education by sexual identification. We'll throw that into the column. We'll throw weight into here and run the table. And there you go. Data analysis, yay. There is so much you can do with the SDA. As you can probably tell by looking at this, it's quite powerful. And I hope that some of you here will have fun playing around with these data in the SDA. So that concludes the general overview, the how to use TransPop data. If anybody has any questions about any aspect of these data, please don't hesitate to reach out to me. I'm quite extroverted and very happy to answer any and all questions. My email is going to be listed, but it's skyd, S-K-Y-D, @umich.edu. And I think we are now ready for Q&A. Or David, there are some slides that you wanted to show real quick. So I'm going to share my screen again so we can take a look at those. Yes, acknowledgements, very important slide. David, would you like to talk about the acknowledgements?
Sure. And then we'll move right from there into some of the questions that are continuing to pop up. I'm like, oh, well, I don't know. And so these acknowledgements are pretty much, hopefully, self-explanatory. This just goes back into talking about different people involved and different units involved, and again, recognizing NICHD, stuff like that. And then if you go to the next slide, you're going to see some contact information. The most important one is, again, just another link to the study. And Skylar just provided her email address as well. So now let's get into the Q&A. Maybe we just leave this slide up, Skylar, and let's get into the Q&A.
Okay.
And so one of the questions is there a way for projects to know what might be ongoing with TransPop data? Currently, the answer is no. Right now, for these data, there is no separate thing that says what data were, who's approved to use what data and stuff like that, particularly since these are a public use component. That would be we don't have the capacity for that. And so unfortunately, no, it's, yeah, want to be mindful. I guess I just answered that live. And now I saw this and a question came up about sample weights, and then Skylar covered sample weights, as did a question about study methodology. So I don't know if that was enough or if that needs to be covered again. The next question, let me just say this though, Skylar, anytime you want to jump in or if you have something to add, just do it, because I can't always see if you raise your hand or something.
Okay, thank you.
Yeah. The next one, let's see. All right, so there was a question about expanding. Okay, so here's the question. I'll read it verbatim. Can you please expand a little more on what the difference between restricted and public data? So if you recall, and I saw something where it was clear that you will be able to get the slides later on. If you look in the collection notes that Skylar reviewed and the documentation, Skylar made mention of coding, particularly around age and geographic variables. So the differences being that if you want access to those additional geographic variables, and if you want access to greater content, I'm looking at the same thing you are. But just so I'm like, okay, well, it's like, geographic variables and age and those things like that, whether a differentiation was made between the public use and the restricted use, that is what you get between those two. And that is why there's those additional restrictions and structuring around that, because that is necessary, again, for protection. Feel free, if that still doesn't cover it and you want more, to ask a more directed question. So there you go with that. If you experience actual issues like with the functionality of the site, that might be something that, yes, I also saw that you would reach out either to the general ICPSR helpline, and or you might have to look at your own, whether you're at home or whether you're on a system machine, like at an institution of some sort, their own IT. Because, for example, one issue that has come up in the chat is that someone's browser hung when they click the data and documentation tab. And do we know if there's a known reason why that might be happening? We don't know why that might be happening. During the presentation, we did some of our own testing and we weren't able to replicate that error. So that becomes a harder thing for us to figure out just during this session. So this one, given Skylar's familiarity, I'm going to put Skylar on the spot a little bit because there's a question about what geographic data is available in the public data sets. One way, so I can see your face, well, I'll let you answer that. Go for it.
Yeah, that's a great question. Off the top of my head, I am certain that there is at least one geographic variable in the public data set, which is census division, that I can investigate and return to this. So David, do you want to take another question? And then when you're done answering that question, I will have a great answer to this question. Does that sound like a good plan?
Yes, that sounds like a good plan. All righty. So that is in the works. And then do you know, the you is us, do you know if researchers have used the weights from these data in other samples of trans people? I don't know. Well, so one reason I don't know is I am trying to parse the question on the spot. And so do I know if researchers have used the weights, meaning apply these weights to other data? I do not know. If you are asking, do I know if people have used the weights when analyzing these data, I also don't know, but I hope they have. Um, um, so yeah, so that would be my answer to that. Another important piece to say, as I'm particularly answering questions, is this. So as we're answering these questions, remember we're coming from the perspective of data dissemination and data archiving and figuring these things out. And so sometimes there might be a disconnect in really what your question is asking and what my answer is or what our answers are, just because of how we're looking at it. So if you really, seriously, if it doesn't get the answer, please ask again and say like, well, this is what I meant, whether or not it gets there or not, because I'm not trying to be evasive. It just might be that I don't always figure this out. Oh, here's another question. I'm just going to read the question. Given the small sample size for the trans population, were any concerns present regarding, for example, race as a variable and a researcher generalizing results? Okay, so this is an important piece. This brings up two things that have come up a few times, particularly as we look at data equity and other things like that. The small sample size idea, and it's an important distinction, an important thing to worry about. So I would say yes, great care and concern has been brought to this. In addition, there comes the point of the balance of when you're doing that, also thinking about, okay, but sometimes, and this is not saying this is where this question is coming from, we're talking about a broader perspective, and this is especially why this is important. So why these data are so important is that a lot of times smaller sample sizes means we collapse and you don't see that. And so there has to be that space there for the smaller sample sizes and the thoughts about, okay, well, what is this going to mean? So maybe no, you can't generalize some of these results to other groups. And if that, and in some cases you are. Now, again, go back to the YouTube video from the researchers for the more definitive answers to these kinds of questions, because this gets into analysis and what you can do. And again, staying in our lane, you know, we want to stay in our lane. We disseminate. But so go to that YouTube video, think about that, go to the user guide. I say all that, and there is a definite space to be thinking about, worry about the smaller sample sizes and think about, you know, how you, and all of us, right? Because probably if you're already here, you have a certain disposition to being inclined, you know, to I would say to wanting to do good research, you know, and use these data appropriately. So that's not like, you know, active aggression. But we still all need to be thinking about how our assumptions and how we're using these data and what's happening can affect, you know, outcomes. But also in this particular case, what a thing has been particularly salient, um, uh, particularly, you know, in my status as being a cis male, is not understanding all the ways that it could be problematic. And so we really, as we're looking at data equity and trying to figure this out, being aware of that and thinking these questions through.
That was a great answer. Thank you so much, David. And in the time that you gave that answer, I figured out an answer to the previous question. There are two geographic variables in the public data set. census region, and census division. So census region, there are 4 categories: Northeast, Midwest, South, and West. And in census division, there are 9 categories: New England, Middle Atlantic, East North Central, West North Central, South Atlantic, East South Central, West South Central, Mountain, and lastly, Pacific. And the way I figured that out was I quickly scrolled through the list of variables and found the 2 geographic variables. Do we have a next question to answer?
Well, we did. And part of that was a question about source of the data for a particular region. And so you answered that almost, it was like, question came up and you answered it with your great explanation.
Thank you.
Now, if everyone could give us a moment to search through our questions again.
Can you give a few words of background on the study methodology? That's an excellent question. The methodology was very innovative. There was never quite any study quite like this one before, but thankfully the PIs have paved a path for future studies like this one. They've proved that a probability sample of transgender Americans can be conducted. And while this was the first one of its kind, I hope it will not be the last. So the first phase was a combination of random digit dialing and address-based sampling. And they actually had Gallup as the survey manager, and Gallup helped with recruitment. So 430,000 people of the general population were screened, and that yielded a transgender sample of just 274. Those people were sent a separate survey designed specifically for trans people. It asked questions like proximity to an LGBT health clinic. Yeah, the PI webinar, they actually go into the methodology for over 10 minutes. It's an excellent explanation. And if you're curious about the methodology still, I would highly recommend that webinar. It's actually the very first section of that webinar. And also the metadata on the study homepage has a very detailed list of the study methodology.
All right, great. One other question came up. Do I have the time, Anna?
I was just going to say we are about up on our time, but we could answer it very quickly.
Okay, so I'll be very quickly. Be very quickly. That's an odd thing, but anyway. So we would ask people, because this came up from the perspective of a frontline applied provider of services, most interested in how to find conclusions and recommendations. And in this question, there's also acknowledgement and a shout out for the 2015 US Transgender Survey done by the National Center for Transgender Equality. Those data are also available at ICPSR. For that type of information, my suggestion would be to go to that TransPop website, transpop.org, and look under publications and presentations, and also look under their media spotlight sections as well. I know what you're talking about, where on USTS they have certain areas like white papers and other things like that. That's where I would start for that sort of information. That's what I would say.
Fantastic. Well, as you may be able to tell, we've had questions flying in fast. There's been some incredible stuff coming in, and I see it still is. So we want to make sure those questions get answered. We will keep track of those. And if there's anything we didn't answer, we can reach back out to you. But please do reach out to us. You've seen the contact information has been available here, and we will send those slides and the recording out to everyone who has registered for today's event. We will also include some of those links that we've had in the chat, including the link to the webinar by the PIs. If you have any additional questions, I see that Skylar has put in her email address here in the chat. So please do reach out to us. We would love to talk to you about these data. As you can tell, we are very passionate about this. I do want to mention that these two have also done a podcast about these data and other data. Oh my goodness, what is it? The US Transgender Survey was in there. So the ICPSR Data Brunch podcast has a really interesting episode around some similar studies, and we will put a link to that in the follow-up email as well as in the chat right now. And with that, thank you so much to everyone who has joined us. Please do join us for the following ICPSR presentations. We have some incredible Blaylock lectures coming up in the next couple of weeks, and you can find all of those on the ICPSR website, icpsr.umich.edu. Thank you so much to everyone for joining us, and we will see you very soon. Thank you so much.
Thank you, everyone.